So this is part B of blood vessels. So really what we talked about in the last video is about blood pressure and the physiology of circulation. So we have to monitor that, and that's the whole point of taking vital signs. So really, by looking at the pulse, which is a measure of the heart rate, and by the blood pressure, which is the delta P, we can make assumptions about the resistance and about blood flow. We add that with respiratory rate, body temperature, and that kind of thing. That we can learn quite a bit about what's happening with the patient. You can take a pulse on any elastic artery. We normally take it on the radial artery because of the convenience and because it really has very few places to be blocked from the subclavian. You can take it superficial temporal, on the facial, common carotid. Oftentimes we do check the common carotid artery. That's probably the strongest one. So in the case of you can't find a pulse, they often will look at the common carotid for it. You can get it on the femoral artery, popliteal artery, on the dorsalis pedis, on the posterior tibial, any of those places. But these are all elastic arteries that still have a pulse pressure. So I'm not going to get into how we take blood pressure mechanisms too much, except that what we end up doing, we use this sphygmomanometer, the blood pressure cuff, and basically what you do is you put enough pressure in the cuff that it actually squeezes the artery closed and doesn't allow blood flow through it, and so it exceeds the systolic blood pressure. Then you release the pressure, and when it reaches the systolic blood pressure, then what happens is at the time of systole, at that peak of blood pressure, the blood squirts past the narrowing caused by the cuff, and you hear it as a sound with the stethoscope. So you hear that spurt sound, and so that's the systolic blood pressure. You keep on releasing the pressure until you reach the diastolic blood pressure, and at that point the blood is flowing freely throughout the entire heartbeat, so the sound goes away, and that's how you measure blood pressure. They cycle. There's all kinds of reasons why blood pressure changes, not the least of which is hormones, age, sex, weight, mood, even posture will vary blood pressure. So one of the things that's important is to take blood pressure often in various circumstances, and then you kind of average it. There's something called white coat syndrome, where people's blood pressures go up because their blood pressure is being taken by a medical professional. We call hypotension is blood pressure that's too low. Usually it's systolic below 100. And sometimes the blood pressure can be so low that when you stand up quickly, the blood pressure will drop and the person will have a dizzy spot. Hypertension is high blood pressure, which is an arterial blood pressure of above 140/90. And that's important that the diastolic pressure be part of this calculation too. It could be chronic, or it could be acute, transient. You get pissed off, your blood pressure will go up. That's not treatable hypertension. That's just a temporary hypertension. they call it the silent killer, but you'll talk about this all in your pathology classes. So I'm going to skip over these ones. These are all homeostatic imbalance, right till we get to here. So we so as we talked about before, when we talked about the respiratory system, perfusion is the amount of blood flow to a tissue, right? And it's about delivery of oxygen and nutrients to removal of waste from those tissue cells. We talked about the external respiration, the gas exchange with the lungs. There's also the same sort of thing happens as absorption of nutrients in the digestive tract and formation of urine in the kidneys. But really what this is the amount of blood that flows to the organ or the tissue is exactly what that tissue needs in order to function properly. If not enough is delivered, then the tissue doesn't function properly, and homeostasis increases the flow to that tissue. It increases the perfusion. If the blood flow is too much, then homeostasis slows it down, and you get less. So you get exactly what you need. Right? So this is an example of to where the blood flows to. Your brain always gets about the same amount because your brain is constantly using oxygen at the same rate. So it always gets about 750 of the 5.8 liters. Your heart, as you exercise, triples the amount that it gets. Skeletal muscles get 10 times the amount. Your skin gets way more because it helps you radiate heat. Kidneys get way less. That's why when you're exercising, you don't have to pee as often. Your abdomen gets way less, and so does everything else. So we redistribute to the tissues that we're using as we're needing the thing. So obviously when you're exercising, skeletal muscle becomes a real hog to oxygen and to tissue perfusion.